Hello everyone. Today we'll be learning about cataract. We all know that cataract is one of the very important topics as far as MBBS is concerned, and even for those preparing for the NEET PG entrance exam, a lot of questions are asked on cataract. So I'll be teaching you about the basics of cataract, the etiology, classification, etc. So, as we know, the word cataract, which actually is defined as nothing but opacification of the crystalline lens. We all know about the human crystalline lens, which is responsible for about 1/3 of the refractive position of the eye. Now, cataract is a Latin word, which has been taken from a word which means waterfall, because in olden times it was believed that cataract is because of bad humor. So, what is the classification? Etiological classification is based on the origin of cataract, how it is formed. So, if it is congenital or which is present from birth, it is known as congenital, or something which is acquired after birth, it is known as acquired. Now, reasons or etiology of acquired cataract can be senile, which is the commonest. Then comes traumatic. If there is a trauma, it can cause cataract. Complicated cataract due to some other illnesses in the eye. Metabolic reasons like diabetes or Wilson's disease or any other storage disorders, etc. Then you have electrical, which is because of the electrical shock. Radiational, in case there is a radiational injury, either because of the radiation leakage or because of chemotherapy being given, wherein the eye can develop cataract. It is known as radiation cataract, or toxic because of some kind of poisoning. The second type of classification is morphological classification, that is based on the position or the appearance. So, here you need to know the anatomy of the lens well. We all know that crystalline lens is a encapsulated structure. So, if it is at the capsular level, then it can be capsular, which can be, depending on its position, anterior or posterior. Then you have subcapsular, that is just beneath the capsule. Then you have cortical, that is the outer fibers or the cortical cataract. Central or the nuclear cataract, or polar, or which can be either anterior polar or posterior polar. What is the metabolism involved in formation of cataract, or what is the metabolism of lens, which is extremely important for your long questions, short questions, as well as in your MCQs. Composition of lens is 99% water, 1% protein and electrolytes. There is an active transportation, diffusion and synthesis of proteins. Here we can see some images. These are the slit lamp images towards the right, and this is how we can see the distribution of cataract. As you can see, this is the human crystalline lens, where you have an encapsulated structure called the lens. In the anterior pole, if it is there, it will be known as anterior polar cataract or a posterior polar cataract, right? What is in the periphery is known as the coronary or the peripheral cataract. Anterior cortical cataract, subcapsular cataract, central will be the nuclear cataract. If it is in one lamella, see, it's a layer. Lamella is nothing but layer. Sometimes, suppose in a third trimester or second trimester during the formation of the lens, if the mother has some illness which has caused lenticular opacification, then this stays lifelong as lamellar cataract. and posterior polar, as I had already mentioned. Now, towards the right side, you can see a few pictures. These are the retro illumination pictures of the cataract when seen on slit lamp. Retro illumination is when the illumination is set at such a level that the illumination comes reflected from the retina and hence it looks like a red glow. In that backdrop, depending on where the cataract is, the opacity can be seen. This is a typical coin-shaped appearance of a posterior polar cataract. Now, since this is a highly simplified lecture, I just wanted to give you an overview. How will you treat cataract? The cataract can be treated with surgery. There is only one treatment for cataract, that is by doing surgery. Now, what are the surgeries? ICCE, which is no longer actually practiced, but sometimes there may be condition which may have to be practiced. But however, ICCE is a surgery of the past, which means intracapsular cataract extraction, where the cataract is removed along with its capsule. Here, there is no scope for putting an IOL, intraocular lens. However, there are some other methods where we can treat it, that is by putting an iris claw lens or a sclerofixated. We will come to it later. Since this is just a basic lecture, if you are asked what are the surgeries, you should know these are the surgeries of cataract. Second is ECC or extracapsular cataract surgery. Then you have SICS, which is also an ECC procedure, but it is known as small incision cataract surgery because the size of the incision is smaller, and here the technique is such that the lens can be kept inside the capsular bag. Then you have phacoemulsification, which is very much the standard practice these days, wherein ultrasonic energy is used through a tip, a phaco tip. The cataract is emulsified and the intraocular lens is placed, which is known as intraocular lens, posterior chamber intraocular lens PCIOL, is placed in its position and the patient gets very good result. And then you have FLACS, which is femto laser assisted cataract surgery. When you have a case of cataract in your clinic, you should know how to do the pre-op evaluation of a cataract patient, which involves complete blood count, that is patients, the hemoglobin, the WBC, the differential counts, the platelets, etc. Then you have the blood sugar level, because if somebody is suffering from very high blood sugar levels, we do not operate. We want the patient's systemic condition to be well under control before we go in for surgery. Then you have the viral markers, which take care of whether the patient is suffering from HIV, HPS, AG, VDRL, or any other HCV infections, etc. VDRL can also be done. You have the bleeding time and the clotting time, or PT-INR, to know the coagulation status and the bleeding time. Then the heart condition, ECG, is an essential thing because most of us operate on senile cataract and patients are liable to have some kind of heart disability. So we have to rule out any of these with an ECG. Then rest of the investigations are case-to-case basis, depending on what their condition is. So this involves a pre-op evaluation, that is a laboratory evaluation. Then how do you prepare? Once the patient has been diagnosed as cataract, they are counseled for the surgery, the type of surgery which will be offered, and once the patient has consented that they want to go ahead with the surgery, then comes the preparation, that is taking care of the lashes, the hygiene, the pre-operative antibiotics, good general hygiene, good metabolic control, well-controlled hypertension, systemic condition should be sound, sac syringing has to be done so that there is no nidus for infection in and around the eye. other preparations which need to be done, which are essential, because if you are placing an intraocular lens, we should know what is the IOL, which type of IOL you need to put. Depending on the type of IOL, the A constant, we calculate the type of IOL, keeping special instruments ready if there are some other complications, local complications like zonulolysis. Then you may have to keep a CTR or a backup lens, pupil expanders if the pupil is not expanding, a toric set if there is a toricity. Operation theatre protocols should be followed, complete ultra clean operation theatre, and subsequently we go ahead with the surgery, do the surgery of choice of the patient with full informed consent. Then we come to the post-op care. Once the surgery has been successfully completed, post-op care is as per the procedure. However, certain common instructions as far as not putting any water into the eye or rubbing the eyes unnecessarily, all the medications as given. Immediate post-operative examination, post-op care is important, not lifting weights, not going into dusty environment. Immediate post-op basically has to be taken care in such a way that the patient's eye does not catch any infection and the patient is able to sustain the period where the healing is going on. However, the post-op period usually extends to a period of 1 month or beyond, depending on whichever type of surgery has been done, like in ECCE where the sutures have been given, or in SICS where a larger incision than phaco has been given. About 6 months to 2 months, maybe 6 weeks to 2 months may be required, otherwise it is a shorter period. However, till the patient recovers completely, post-op care is important. From time to time we may ask for multiple visits, multiple post-op visits. So now follow-up depends on the surgery related, then optical correction. Finally, when the surgery has healed well, we give glasses, optical correction is given, and any special advice, if at all, can be given. So with this, I come to the end of this very short overview of cataract. However, deeper lectures on metabolism will be